Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about vasectomy. Now, what's an OB/GYN physician doing talking about a vasectomy? That's obviously the realm of a urologist or a family physician. And so you're right, I do not have expertise on vasectomy, but my videos are here to give you my experience and years of experience as a practitioner with patients. And I do have some insights for families and couples that I've taken care of my patients whose husbands and partners have had a vasectomy. So first I can tell you it ranks as one of the highest, most effective modes of birth control. It's permanent, of course, and it's on par with getting a tubal ligation for a woman. And the vast majority of men do great, wonderful. I have friends who've had it, lots of colleagues, and just the literature goes with that. But the reason that I'm making this video is that I have had 3 patients tell me of a problem or an issue that they had with their husbands who had vasectomy, and they asked me to tell my patients this because they weren't aware of it. Okay, so unsolicited, they brought it up to me. So deliver babies, see the patients for the postpartum visit, give them all the options, and they say, oh, well, they have a vasectomy plan. When you get a vasectomy, you need about 6 months of coverage. So I offer them some short-term coverage until they get the vasectomy. And then I had a patient come back a year or 2 later and say, I just want you to know that my husband had a vasectomy and he now has pain with sex. And we're not happy about it. Of course, obviously not. And I followed that patient for years. And in fact, I've had 3 patients with similar stories say the same thing. 2 of them, the pain went away in about 2 to 3 years, but one of them going on over 15 years, it never went away, and they weren't happy about it. So it's a small side effect that's rare, not a small, but it's rare, but unsolicited. I didn't ask them, they came to me and mentioned it to me. So you need to figure that in. As you'll see and read, a lot of the literature discuss how it's a little easier and lower risk for a man to get a vasectomy in the office than for a woman getting anesthesia to have their tubes tied. That being said, that is true. Those risks both are infinitesimally small, tiny, and you need to take it into context. Have I ever seen a woman tell me that she had pain with sex after getting her tubes tied? No, I haven't seen that. So something to take into account. There are women, though, who tell me their periods are worse. Just as a side note, we're not talking about vasectomy. And that is not because of getting the tubes tied, it's because they've been on the birth control pill for years or pregnant, which makes your periods nicer. And then when you get your tubes tied, you don't need the pill anymore. And then that brings back the reality of what periods are like for some women. Pain with ovulation between periods and pain with the periods. That being said, I am not condemning vasectomy. I think it's a great method of birth control, highly effective, and certainly should be considered. But when you discuss it with your family physician or urologist, ask about that side effect and factor that very small risk, but non-zero risk of that effect. I hope you found this helpful. Thank you.